Sickle cell disease is an inherited blood disorder which affects the protein called hemoglobin, the protein that makes our blood look red, which has the function to carry oxygen to the tissues. In sickle cell disease, because of a mutation in that protein, the hemoglobin forms a gel when oxygen is starved in the tissues. And when it forms the gel, the red cell, which should be in a donut shape to be able to flow freely through the small blood vessels, assumes a sickle shape, hence the name sickle cell disease. Now, this sickle shape is significant because it makes the red cells sticky to the blood vessels, which inhibits their flow through the blood vessels. In small blood vessels, in the course of time, this will be enough to block the small blood vessels and starve the tissues of oxygen. This results in acute bone pain, which is the hallmark of this disease, excruciating pain because the bone is starved of oxygen. In addition to small vessel damage, these cells damage the smooth lining of large vessels. And in the course of time, the muscle in the wall of the blood vessels thickens, and as it thickens, it narrows the lumen of the blood vessels and ultimately could cause a complete blockage of the blood vessels. And this is what may lead to stroke, that is, blockage of blood supply to the brain, but it can affect virtually every organ, the lungs, the heart, the kidney, and virtually every organ in the body that needs blood supply. Consequently, though this is primarily a blood disorder, its impact is systemic. It affects virtually every organ because every organ in the blood needs blood supply to be able to function normally. So we think of sickle cell disease primarily as a blood disorder, but in fact, it is a disease of virtually every organ. I have to come back to the hallmark of this disease, which is acute excruciating pain. It is the number one manifestation of this disease that affects the quality of life of patients. The pain is intense and requires aggressive pain management, which is something that is not adequately done within our healthcare system. And we are working with partners within hospitals and within communities to address this issue. The other major manifestation of this disease, which is concerning, is its effect on the brain. In fact, if this disease is not properly treated in countries of the world where they have no access to treatment, nearly about 10 to 12% of children with this disease will have a stroke before they become adults. We've been very good at preventing this kind of stroke because we screen them and we give them blood transfusions to prevent those who have stroke. But what we haven't been able to prevent is what we call silent strokes. Strokes that occur, multiple minor strokes that occur in the brain, but with no overt sign of weakness of the body. This kind of stroke could occur in about 1 in 3 patients with the severe form of sickle cell disease. The reason this is important is that this minor stroke, called silent stroke, may affect the neurocognitive function of the patient, and is the number one reason why sickle cell disease patients may have problems with their schoolwork, and they may have educational challenges, not because they don't work hard, not because they don't want to try, but because actually the brain has been damaged through multiple minor strokes. And I think this is something that needs to be recognized within our educational institutions to realize that this patient population require adequate support to recognize neurocognitive impairment and school performance deficits so that we can provide adequate remedial steps to ensure that they attain their full educational potential. So in a nutshell, it's an inherited disease. It is primarily a disease of blood, but can affect vital organs. And most notable of them is the bone pain, which is excruciating, and its effect on the brain, which could have neurocognitive and school learning impact. Dave, nice to see you. Knowing that you're living with sickle cell disease, how are you coping with learning at school?
Well, my teachers know that I have sickle cell, so they do several things to help me with it. They know that I need water with me at all times, and they know that I have to use the bathroom a lot.
So for some students who have sickle cell disease, they have some trouble with thinking and learning and remembering, and that's because of the way that the disease affects their brain and their thinking skills. Do you have any trouble like that?
Yeah, I forget a lot of things sometimes, and because of that, my teachers, they give me reminders by giving me the work that they did, and for instance, for math, I get extra help on that, and whenever I'm away, my friends, they come to my house and bring me homework, and one time when I was in the hospital, all of my friends, they wrote a card saying that they miss me and they want me to come back.
Nice.
Students with sickle cell should be given consideration about having their water bottle in class, and they should be able to go to the bathroom frequently. The water fountain in the schools, the water, it should be kept clean so the students can get their water from this water fountain. If they run out of having a drink, they will probably get into a crisis. So we advocate for them to have supplies in the schools for them to get their drink. We have a sickle cell comprehensive clinic at the Hospital for Sick Children, and we're available to help all schools. We have psychologists, we have doctors, we have nurses on our team, and we'll be able to provide any information for teachers and students within the school.
Students with sickle cell disease are faced with a number of psychosocial stressors, and a social worker can support them in various ways. Some of the triggers could be around financial constraint, as patients has various medical appointments and also transportation issues and getting to appointments, which can be difficult for families. Therefore, supports with school trips, any type of subsidy available for that or for tutoring would be beneficial. Another trigger could be self-image, as patients with sickle cell disease may feel different from other patients and they may need some support around coping with that. Frequent hospitalization that they're dealing with and may have missed schoolwork, so they may need accommodation and your advocacy support in getting this accommodation. I am available. I work at UHN in the comprehensive treatment program for patients with sickle cell disease. It is called Red Blood Cell Disorders Program. You can reach out to me, especially for students who are adults or the older, the more mature students.
The limitation that accounts for sickle cell disease has arisen as a result of protection against malaria. What we do know is that any person who is a carrier of the sickle cell gene is better protected against malaria. Consequently, all areas of the world where malaria was endemic have sickle cell. This includes sub-Saharan Africa, this includes the Arabian Peninsula, areas in India, some portions of Europe, southern Italy, Greece, and where all people from these areas have migrated, including North America, and now to almost every part of the world because of migration. So in effect, sickle cell disease is not necessarily a black disease, but it's a disease that affects areas of the world where malaria has been endemic. The WHO, which is the World Health Organization, and the United Nations have recognized the major burden that sickle cell disease poses in the world. We believe that about 1,000 babies are born every day in the world with sickle cell disease. Unfortunately, in low-income countries, many of these patients would die before the age of 5. The United Nations declared, therefore, that the world needs to pay attention to this disease, and therefore declared that June 19th every year around the world should be celebrated as World Sickle Cell Anemia Day, an opportunity to raise awareness about this disease, to create more partnerships between all stakeholders who need to come together to tackle this disease. So we look forward to June 19th this year, when we can all partner together to raise awareness about this disease, and in so doing galvanize support and partnerships that are needed to tackle this disease. with all of you joining together, we think we can make significant progress and make the lives of patients with sickle cell disease much, much better.
In collaboration with the Hospital for Sick Kids and the University Health Network, Sickle Cell Awareness Group of Ontario, Sickle, will provide support, informational resources, forums, seminars, in-school presentations, and other support mechanisms for educators and social workers in the school system. For more information, please visit www.sicklecellanemia.ca and by email education@sicklecellanemia.ca.